Like to ask any questions about any of the presentations? Yes, sir.
Mr. Lim, what oil would you recommend us to consume in Malaysia, and at what dosage?
At what dosage? Okay, medium chain fatty acids. Right, a good source is virgin coconut oil. Now make sure get a good source of virgin coconut oil that is high in lauric acid and capric acid. Now, and also take high sources of those with omega-3 and omega-6, but in the ratio of 3-4 of this omega-6 to 1 pound. And a good source is things like perilla oil, chia seed oil. Now, flaxseed, if you don't have a choice, you can opt for flaxseed oil too. These are all the important fats because they are important for your inflammatory response, for your hormones, for cell wall development, for your brain nutrition.
Where can you get this oil?
I think Trumer, you have this oil. You can also get from the pharmacist. You can get from pharmacists. This discovery, actually medium chain fatty acid, was actually by Dr. John Cabrera and Dr. Mary Agnick. He is also biochemist and a scientist. He found this mother's milk. The mother's milk has these fats. But when we grow up, we don't take mother's milk, and our body lacks medium chain fatty acid, lauric acid, capric acid, and capric acid. He tried to find this in USA and Europe. In the temperate oil, we couldn't find. Finally, he came to the tropical. He found some in palm oil, but it's very little. It's only 3.5%. Finally, he encountered it from coconut, and the extraction process using non-heat to extract this medium chain fatty acid from coconut. And when this was taken, there was tremendous improvement in many of the patients. So try to take medium chain fatty acid, omega-3 and omega-6 in the right ratio. You can get it even from the pharmacist.
Okay, now my next question would be, I heard that oil mixed with cottage cheese. Oil mixed with cottage cheese.
Oh yes.
Have been good for cancer patients. Can you elaborate on this?
Thank you. Very well. Okay, this is actually Dr. Johanna Buckwheat diet. Basically, Dr. Johanna Buckwheat, the German doctor, she has been studying, just I was mentioning, when he looked at when he do all the study on the cancer patient, he found that there was a yellow pigment there. And this was related to a shortage of essential fatty acid. Or in the earlier days, it was the energy level of the cells. What she did was she fed the patient first with actually flaxseed oil, a source of omega-3. And over the month, the patient improved, but it was slower. There were a lot of cancer patients that were very acute. So what later on she discovered was using cottage cheese. Now in the cottage cheese, there's one of these amino acid cysteine. So what it does is, according to Johanna Buckwheat explanation, it was able to turn the fat soluble into water soluble and gets permeable into the skin, into the cells, and immediately gives the energy of the cancer patient. And a lot of cancer patients, only a report was saved through Johanna Buckwheat's diet. So that is. But I think today what we found is actually the cell wall, because the omega-3 is very important. The type of fats that you take affects your cell wall. And this cell wall is so important. The exchange of gas, oxygen and carbon dioxide, the release and the absorption of nutrients, whatever food that you take, it has to go through the cell wall. And this actually helps. Basically, they found cancer patients deprived of the cellular food and energy. So this methodology helps actually to improve the health status of cancer cells. Does that answer your question?
My last question would be this. Can we use cottage cheese with VCO or extra virgin olive oil?
Yes.
or flaxseed oil?
All right. The latest finding that we found that too much flaxseed oil is not very desirable. And second is because of the high level of omega-6. Secondly was flaxseed oil is not stable. You need storage. You need to grind them and consume them. If not, they get oxidized very fast. So towards the later decade was actually a lot of research into lauric acid. Till America and Europe, they set up a lauric acid foundation to study, and they have actually stabilized this lauric acid from virgin coconut, turning them into this lauricidin, which is great used for treatment for cancer, AIDS, and many other symptoms. Even today, the baby milk powder are fortified with lauric acid, with this medium chain fatty acid. So you can actually substitute now flaxseed oil with virgin coconut oil into your cottage cheese for those cancer patients or those people with. They have been found quite effective for actually those some cancer patients. Okay.
So from your answer, can I take to mean that virgin coconut oil and flaxseed oil are not similar?
It affects what?
They are not similar.
They are not similar, but the source of they directly actually go straight in the form of ketones in the body and generate energy into the cells. That is what it does. What it actually is, we have to have the energy and the nutrient level, and also improve the structure of the cell membrane.
Okay, thank you.
Okay, thank you very much. Yeah, as I said, this vitamin E has a few types, the tocophenol, tocotrienol, and I'm not really an expert in vitamin E, but researchers now have found that you've got to get the right type of vitamin E, the tocophenol, into the body because of the nutraceutical values. I think earlier on, even Dr. Anton, when you have in the body, there's always one that is carcinogenic, the other is anti. So you need a balance of the right amount of type of vitamin E in your body. So more research are now in-depth research. It's just like earlier on, if you look at even fats, in the old school of fats, everybody fat causes heart blood disease, causes so as research goes in, we begin to narrow down and find into in-depth, the same as vitamin E. Like earlier on, if you saw the earlier presentation, the estrogen quotient. Those days generally, there was a very general statement, estrogen dominant causes is highly linked to breast and ovarian cancers. Today it's not just estrogen. We know the estrone, estradiol, E1, E2, and E3. You have too much E1 and E2, you have problem. You have good abundance of E3, it's good. See, so this is what research are now going in. So vitamin E is very general. So we want E2, E3, and there are some of these that are actually beneficial and have high nutraceutical value to our body. So we have to have a right balance of that. Okay, thank you.
All right, any other questions?
Good morning, gentlemen. I have a question for Dr. Tan. My question is that does cleaning the nose, cleaning the nasal passage with saline solution is a way of...
Saline solution?
Saline solution, yeah. It's a way to prevent a nose cancer.
I think saline solution, you can use any water. You can use water to clean. And then I clean my nose in the morning when I bathe. And I clean my nose in the evening. I'm just a habit. Whether it's related to preventing cancer or not, I'm not sure. But then I clean my nose. And then blow my nose, clean my nose. But you can also buy this solution, saline solution, to irrigate the nose. You actually spray it inside or squeeze it inside, and then from one nostril, it will come out to the other side. I think you can buy it from the pharmacy. And they use saline water. But I don't do that. I only clean it with water. So it's just a habit. Whether it's related to anything, I have no evidence for that. Just a habit. When I bathe, I clean my nose. When I brush my teeth, I clean my nose. Just a habit.
Thank you, Doctor.
Well, look at the recent events like Steve Jobs. He's the boss of Apple Computer, and he survives pancreatic cancer for 8 years. According to the statistics on pancreatic cancers, people who can survive pancreatic cancer under conventional treatment for 5 years is only 1%. Okay? Those who can survive pancreatic cancer is only 1% for pancreatic cancer. But Steve Jobs opted for alternative treatment, and he has survived for 8 years. Treating your personal disease is a personal choice. And then if I opt for conventional, I opt for chemotherapy. If I opt for radiation, it's my choice. After I hear all the pros and cons, and eventually I have to make a decision. If it's life and death. I mean, up to now, there's still no cure for cancer. We know eventually we are going to die if we have cancer, especially 3rd stage, 4th stage. And at that time, your decision determines your survival, to live or not to live. So how can I tell you, you should do this? I can't.
It's cheaper anyway, isn't it?
Yeah, but if you ask me personally, I wouldn't go for chemo, I wouldn't go for radiation. I will try other means. But it is obvious that people who, if you don't do anything, you can survive for more than 5 years. If you get treatment, you also survive, at the best is 5 years. That's all they can promise you. So what the heck?
But this,
If you have 1st stage cancer, 2nd stage cancer is easier to cure. But I'm not saying conventional treatment is totally useless. I'm saying that if you have 1st stage, for example, colon cancer, you go for surgery, you can cut off 1 or 2 feet of your colon or your intestine, you survive at that stage.
if you don't mind, when you discovered your nose cancer, what stage was it?
It is very initial stage. It hasn't spread yet.
Correct me if I'm wrong here. I think the fact that we live in an age where everyone has access to the internet, to Wikipedia, to a lot of different sources of information and research concerning new treatments, mainstream or holistic or alternative or otherwise. I think it's whatever, like what Dr. Tan said, the onus is on us to take charge of the course of treatment, whichever treatment that you feel is the best for you at that point in time. Right? That's the one that should give you hope. The fact that there's so many different alternative treatments that are out there should actually give a person more hope than what is traditionally available in mainstream medicine. Right? All right. I actually have a question for the both of you. If you could answer it one by one, that'd be great. How does a person actually make an assessment as to the state of imbalance in terms of hormones, in terms of fatty acids, in terms of key nutritional elements within their body, from a practical day-to-day standpoint?
As I say in my talk, you can actually analyze your blood, your feces, and your urine in the lab. All the ratio that I mentioned, the 2:16 ratio, you can analyze your hormone. Actually, I just got my hormone tested, but I cannot get all the tests I want in the lab. So there may be certain labs are able to analyze all this. That's why there are more information now that you can, the tests available that you can actually assess your own risk. more and more all these tests is coming along. But not all the lab offer this test simply because no demand. I'm sure if more people are asking for these sorts of tests to test for the E1, E2, E3, the lab will certainly be able to find the methods, because these methods are not new. You know, they can buy these methods, they can buy all the test kits and so on from the manufacturer and all the people who supply all the testing material and so on. So I think there's no demand, very few people know about it, that's why the lab don't offer. But if there are more demands, the lab will certainly be able to offer this type of test. So if you are able to test all these things, you are able to know a bit more certain about your stage of risk that you are facing at this moment. But as I said earlier, there are certain things that we can do to help ourselves. Number one is to control our diet. Don't overweight. Don't put on too much weight. Make sure that you are in your BMI and so on are actually proper. And don't overeat. And take a lot of fiber. Take a lot of vegetables. Don't take a lot of red meat. And so on. I think there are certain things that we know. These are things that we can encourage our body to produce more good cancer-fighting molecules. I think these are the things we do, you know. And I would certainly encourage your Trumer Foundation to organize every week, you know, maybe walking, maybe playing table tennis, badminton, and so on. I think it would be a good activities that your organization can provide your members. And then also doing the right thing. First of all, we ourselves must keep our weight down. So in order to, how can parents tell the children, don't put on weight? How can the doctor tell the patient, you must control your diet? They themselves are overweight. You can't do that. You yourself must keep fit. Alright? In order to tell your patients, your children, that they have to keep fit. So first of all, start with ourselves.
Lim, have you anything to add?
Yeah, I think what Dr. Tan mentioned, go for a checkup, or you see things are not right, you're getting very tired every day, like the girls, the menses are not coming, go for a checkup, go to the diagnostic lab or go see a doctor. You could easily map it out.
This, you were saying that makan ikan goreng, fried fish, no good. Irrespective of what oil you use. Because Malaysia, you know, all Indian, the Malays, the Indian, ikan goreng.
Okay, thank you, Dato'. Don't get me wrong, I'm not saying fried fish no good. The oil that they use, if you continue until some over the heating point, some of the oil being recycled, you use, imagine some of the goreng pisang, the oil, and those are actually they are carcinogenic, they are not good. Right. What I mean is, when you overuse your oil until your oil has become carbon, yeah, that is bad. It's bad for your body. Not fried fish. Fish is fine.
I would like to say something, not to contradict you. I still like goreng pisang. I love to take goreng campudak. And I like to visit restaurant to sometime for a piece of steak and so on. I'm sure all kinds of bad oil they are using. But I think life is balanced. We have to, as long as we don't do things excessively, I still like enjoyment when I travel, to spoil myself occasionally, to take all the fried things and so on. For example, recently I went to Cameron Highland. On the way, I took some friends from Sydney, and we saw the goreng pisang, we saw the campudak, we cannot resist it. You know, it is so wonderful. And then we stopped at this Tampa, the R&R station. So we saw the beef rendang. I don't know what oil they use, but you know, we enjoy it so much. And then, so I think life is a balance, as long as you don't do anything excessive, you know. But that being said, I think exercise, a lot of vegetable, you know, your bowel movement is very important. Make sure that you go to toilet, flush out all the toxins, and drink plenty of water to clean your body system. I think those are important things that we should do all the time. And enjoy our life. And if you want to take only those, that only virgin coconut oil, rapeseed oil, you can't go to any restaurant. Your life will be so terrible. I think we want to enjoy our life a little, you know. So I think everything is boiled down to getting a good balance. Sorry.
Those are supplements. What Dr. Tan says. Enjoy your life. Enjoy your life. Don't torture your life just drinking that. At the same time, supplement. Balance here, that's all. These are supplements. Supplements are important. You are what you eat. If you do not take care of yourself 10 years, 20 years down the line, all these degenerative diseases may appear. So you are responsible for your health. If you are healthy, your whole family is happy and healthy. You get sick, everybody is unhappy. So you are responsible for your own health. Yeah. Thank you.
I just emphasize, supplement is good, but exercise is equally important. Don't forget that I just take supplement, I can just sit down and sedentary and watch TV whole day and night. You won't get good health, and that is, I can assure you, you will never get your body in good condition. You really have to exercise. Your muscle have to move, your joint have to move, and apart from that, your brain have to work. You must work your brain whatever age you are. You must have new challenges in your life every day that your brain is exercising, working. That will be a very important part of life, I think.
Thank you very much.
Dr. Tan, from your research, readings or whatever, do you have any statistics that says that people who are in the fourth stage of cancer survive how long?
No, I do not have such a big range of statistics. As I said in my presentation, for the last 10 years, I only have about 300 people who are I have prescribed this supplement, and then not all survive. Some do survive, completely cured, just like myself. Some live longer, at least they don't suffer.
How many of them were in the late stage?
Actually, there are many. There are many, because by the time they come and see us, they are already in a very bad condition. So, because my office is on the 3rd floor, some of them have to carry up.
Okay, I think we have time for one last question. Would anyone like to? Yes, sir.
Yeah, Mr. Lim, how do you take your virgin coconut oil? Just as it is, or?
Okay, that's a good question. Now you can take it in many forms. You can put it into a salad too. You can also take them in those. They are now some in soft gel form, right? You can some of them after they cook their rice, they just add some in, and it's very fragrant. So it's up to you, but prefer if you can take it direct and take about a tablespoon a day, good enough for you.
So if some people use it for frying, it will destroy the nutrients?
We will not recommend, even though in some of the research say they are very stable, but we prefer oil not to be more than 90 degrees or below. So we will recommend try to take it raw if possible. Yeah.
Okay, thanks.
Thank you.
Can I have one question?
Alright, one last question.
Mr. Lim, in your slide, you have slides on discouraging fish oil consumption. Is that in general, it applies to all? Or?
We are not discouraging fish oil. It is one of the paper. The people, the drop in the fish oil is because of these factors. So those vegetarians avoid them. If it is a good source of fish oil, by all means, there's nothing wrong with it's people avoiding the radiation, pollution effect, and all that, and heavy metals. That's all.
So fish oil from Australia should go.
What is it?
Fish oil from Australia.
Fish oil?
From Australia.
Yeah.
From Australia.
Oh, good.
From Japan.
Yeah, many good. I'm not here against no. It's a good source of omega-3 actually. Yeah, but get it from a good, reliable source, basically. All right. Okay.
Sorry, can I just add to this? In Malaysia, all our GMP manufacturers, they have testing laboratories to test all the heavy metals, and then the government, under the Food Act, the amount of lead, mercury, cadmium, arsenic present in any food is controlled. All right, and if it is beyond a certain limit, you are not allowed to sell. So actually, our government have very strict rules on this. So if you any capsule, any pharmaceutical product, any food product, they are under strict control in Malaysia, unless some of these escape the testing, but it's unlikely. You know, it's very unlikely. And the limit of all the raw material before you process, you also must pass a certain level. For example, the amount allowed in lead is 10 parts per million, and arsenic probably 0.5 parts per million, and cadmium 0.3 parts per million. It's all under control in Malaysia. Unless those product is processed by non-GMP and under the backyard, then it may not be reliable. Those in the pharmacy should be reliable.
She read the article in the internet saying that foods containing yeast is no good for cancer patient. So I read to anyone of panel here, give you a comment on this. There's a patient, there's a food which contain yeast is no good for cancer patient. Is it true?
This is the first time I've heard of this. I really can't comment what is the reason behind it. But actually yeast contains a lot of good things, you know. All depends on what yeast. You have the yeast, the brewer's yeast, which contains all that B12. Not B12, B complex, you know. So you can actually get yeast tablet, which is a supplement as a B complex for dietary health. Of course, there's many types of yeast. You have good yeast and bad yeast. Yeast also, the bread that become black, you keep it for too long, that's also yeast, you know. So it all depends on what kind of yeast you are talking about. There are good yeast and bad yeast. But you cannot say just all yeast, because there are some yeast actually that contains a lot of vitamins. And also yeast is used for fermentation and making your bread, for example. So depends on what yeast is being referred to. If your food gets spoiled, actually it is also due to yeast fermentation. So that kind of food that you take, it can give you a lot of problems like stomach problems and so on. So that's also due to a different type of yeast that cause the fermentation and eventually cause the typical smell of food when it is gone bad. Not necessarily bacteria, But of course, your food contains a lot of meat, most likely to be due to bacteria. But if it is carbohydrate food, most likely to be due to yeast fermentation. So all depends on how the yeast is come about. Okay.
Just now the lady asked also about omega-3. Is there enough sufficient omega-3 in eggs or you know?
The omega-3 in the eggs actually they are fortified. The chicken have been fed with actually omega-3 diets, and then this omega-3 goes into the egg, and it's a medium. So you're consuming those eggs high in omega-3. Basically, and you see all those omega-3 diets actually they in the broilers in the chicken, they feed them with high source of high omega-3 sources, and that's why the eggs has high omega-3, and it all depends on how much this omega-3 that they feed to actually the chicken.
Coming back to eggs. Is it better to eat it hard boiled or half boiled?
That's a good question. Well, I really can't answer the question, but I think eggs has sometimes has high bacteria, all this if you don't, you know. But and when you cook your egg, overcook the egg, the protein coagulates, so it's not. So actually, I have to check and come back to you on that. Sorry for that. Maybe Dr. Tan.
Can I comment something about eggs? I think a lot of misconception about eggs. Actually, you know that eggs is a perfect food, you know. The egg itself can produce a chicken. So every nutrient is there, every type of vitamins is there. All the essential fatty acid, whatever you name it, to sustain life is in your egg. Without those things, it cannot form a chicken. So it is so complete, it's a complete food by itself. So come the question of whether the eggs contain bacteria. A lot of people frightened that it may contain salmonella. But a good egg, when you break it, it is properly formed, you can be sure it is free of bacteria. Because no bacteria can be inside there, and when you open up, you crack up the egg still in proper condition. No way. If there is bacteria inside, it will be spoiled. Because the bacteria feed on the egg. What can happen, salmonella, can be on the shell of the egg. So as long as you clean it well, with half-boiled egg, it is temperature 100 degrees, or you fry it or you boil it, it is clean. So what is not clean is the outside. Possible because the eggs come from the farm, and then all the feces of the chicken and so on can be contaminated on the shell itself. But egg is a perfect food.
I'm Tan here. I just want to ask this question to Dr. Martin. Just now Dr. Martin was mentioned that MRSA is usually will be found in hospital, which is the environment on operation, is it?
Yeah, it's found. Okay, firstly, you need to have a clear understanding what MRSA is. It's actually an abbreviation of methicillin. Methicillin is a class of antibiotics. The first antibiotic that was developed was penicillin. Then you come to methicillin. Methicillin is a class or group of antibiotics, which is the new generation antibiotics. Now, Staphylococcus aureus, which is the drug-resistant bacteria, is commonly found in hospitals worldwide. They thrive on blood. So if there is any open wounds, cuts, particularly you are in the hospital environment, you are bound to be infected. Now, what happens in hospitals is that every day we have what we call a medical protocol. In the mornings, we'll have a team who goes around to every corner of the hospital to do swab tests. These swab tests will be sent to a lab to do what we call culture and incubation, to determine whether there are the presence of these pathogens. Now, identification of the Staphylococcus aureus can only be done upon a physician's or a surgeon's order. For example, if the patient dies, after an operation, or dies, after recovery, from being in an ICU, intensive care unit, then it is the onus lies on the physician or the surgeon. In most cases, particularly hospitals in Malaysia, it doesn't happen. If the patient dies, closed case, unless an inquiry is being asked from the family members or relatives. Right? So that's basically the situation. Sadly to say, if a patient is suspected to suffer or die, for example, my late mother-in-law, she died from septicemia. I was present at the hospital. I insisted with the neurosurgeon to do a culture count or a blood count to determine the bacteria that caused that infection. So we did that test, and it was discovered that Staphylococcus aureus was the cause, despite the fact my late mother-in-law was fed with all the antibiotics. That's why it's called MRSA, methicillin resistant. The penicillin or the antibiotic is drug resistant. So no matter what antibiotics you take, as long as you are infected by that particular bacteria, chances of mortality rate may be around about 80% or maybe even fatal.
In this environment, in that case, because usually people will eat the meat, so when they're cutting the animal, is it because this kind of MRSA in the body of the animal?
That's a very good question.
Yeah.
Now, Staphylococcus aureus has never been discovered or found in poultry or in meat, in cattle or in goat, right? It's because of the DNA found in the hemoglobin of human beings. Scientists, microbiologists, virologists, bacteriologists discovered that it's usually more commonly found in human beings. So far, we have never had any discovery of a cattle or a goat being infected by Staphylococcus aureus, or the SA in short.
What it means is
it's other types of bacteria.
Oh, okay.
Yeah, it can be Pseudomonas aeruginosa, it can be Streptococcus, it can be, other types of bacteria, it's a matter of you see, the problem is that in this country, there are many protocols that nobody follows. If you want to find out how the cattle died, of course it's a different story. But if you are infected because the cattle was slaughtered, then you have to do what we call all the usual blood tests to determine whether it's a bacterial infection or is it a viral infection, or possibly you may have been infected by the people around. The people around you, one person may be sick, happen to be near the area where the cow is slaughtered, or the goat. You may probably have got the infection from that person, not necessarily from the carcass of the animal that's being slaughtered.
Okay.
Yeah, not necessarily.
It could be, right? It's a percentage over there, right? What will happen on the...
Everyone say again?
The something, a bacteria will incur on the stroke body or something in the animal.
As I mentioned, bacteria can be caused because, the cow may have already been infected. Right before the slaughter, the cow may have been infected. And to avoid, or, to determine or to decide or whether to, do a blood test, on the cow before you slaughter, lies on the owners of the owner or the people who are, in the abattoir who's going to slaughter these animals. So the veterinary department usually will be called to do a blood test on the animal before it is slaughtered. It's a procedure by the veterinary services department. They have to follow protocol. So before the cow is slaughtered and be given to people to be sold in the market, you're rest assured that the veterinary services department will do a blood test first.
Oh.
So the chances of the meat being infected is almost zero.
Human also being like something like animal. Whatever we have over our human side, of course, the cleanness of the human will very, it totally will take care of a cleaner or whatever purposely to reduce the bacteria over. Yeah. So, but animal is without this kind of process, that impossibility will be causes all kind of bacteria in the animal body. So, if let's say we are cutting off, and also we taking the animal to our body, it will cause bringing a lot of bacteria through the meat, right? So from there, it will cause a lot, something like MRSA happen in our body.
Okay, now God has given us one very special gift. The moment we were born, you know, the first milk from the mother contains colostrum, contains IgG, immunoglobulin, right? And that helps in the moment you're born, the time you grow, your immune system is strengthened to ward off bacteria and viruses. It's all about this, your immune system. So even though you may take something that may contain a little bacterial, contamination, I'm talking about not infection, contamination, even water for the matter, it all depends on your immune system. If your immune system is strong enough, you can ward off, whatever contamination, or comes from, or even infection for the matter, right? I mean, if you have a proper diet, if you eat well, you don't hang around with people who got cough and cold, I mean, generally you'll be healthy. Touch wood so far, for the last 1 year I've not fallen ill because of the diet and the surroundings that I'm in. So I avoid going to hospitals if I can, and so that's one of the reasons of staying healthy.
My question is regarding diet, and if a person has cancer, would the diet for a person suffering from, say, colon cancer, would it be different to the diet for a person suffering breast cancer as opposed to another type of cancer like ovarian? Could it be that the diet for a person suffering from colon cancer, could it be harmful if a person suffering from breast cancer were to take it, for example?
Generally, all forms of cancer, we will recommend a high fiber diet. Go for more vegetable, more vegetable and fruit and less carbohydrate. More like a starvation diet. That's normally we will recommend. I'm talking about natural medicine. I'm not, you go and see an oncologist, he'll say you can eat anything. So normally that's what we will recommend, to take a high fiber diet and vegetable, fruit and so on. Because those vegetable, the fruit, they also contains a lot of cancer fighting substances. For example, broccoli, and then the folates in a very green vegetable, the folic acid, all those are important ingredients for fighting cancer. And apart from that, I think normally we can take anything. We can take other things should be greatly reduced. That's how I would recommend that way. So just come back to ask you a question. If you are totally vegetarian diet, do you take eggs, milk? No. You take fish? No, totally no. Okay. But you will take a lot of beans and so on, tofu, soya and so on, then to supplement your protein requirement.
Dr. Martin, can I ask, is silver one of the heavy metals?
No, it's not. Silver, the chemical name of silver is argentum. If you look at a silver block or a silver bar, it is argentum. That's the chemical name of silver. But silver is not a heavy metal. Heavy metal is cadmium, lead, mercury is part of it, arsenic. These are the formation of the so-called heavy metal group, not silver.
Dr. Martin, you say colloidal silver has got antibiotic characteristics and also is antibacterial. If you take colloidal silver, doesn't mean we don't have to take, let's say, for example, my kid goes to see a doctor, he has an infection, he probably would have to take a course of antibiotics. Can colloidal silver replace this?
We have done very extensive studies, and also we have done human clinical trials on children, even with the School of Pediatrics in Johns Hopkins. We have done trials, where we have actually stopped the children, not even adults for the matter, children, from taking antibiotics, because antibiotics, don't forget, as the children grows, it is very important they maintain, their immunity. Their organs are all functioning very well, and too much of antibiotics can actually cause those kind of side effects. And some antibiotics are very, very strong. What is important is that you need to maintain an intestinal flora, the friendly bacteria, living in the colon or the gut, as it's called. It has to be maintained at all times. So a course of antibiotics will just wipe out all the good bacteria. And at a time will come when the child will always be, dependent, on antibiotics. So the clinical trials that we have done is that, yes, to answer your question, you don't have to take antibiotics. You can actually substitute the antibiotics with colloidal silver solution.
One last question.
Sorry, I have a question for Dr. Martin. You are talking about this colloidal silver taking orally, internally. Okay, so does it go into, certainly will go to the bloodstream, all right? So how does it metabolize? How does it excreted from the body?
The ions, you see, ions are very hyper-reactive with heat and temperature, right? The moment it gets into your bloodstream, the uniqueness about silver in an ionic state, it targets, pathogens. It does not attack, the friendly bacteria, or it does not attack the RBCs or the WBCs or even the hemoglobin. The temperature in the blood will allow the ions to dissipate. So it actually breaks down and it just goes off. Any remnants or remaining of ions, accumulated will probably be maybe 20-30 years down the road. If there is any, the problem here is that there are too many companies, in the market, even in the world, around the world. They claim that, their colloidal silver is better than the others. But again, I've got no comments about what they say or what they claim. It is very important to understand, how a ionic silver works in the first place. And the blood is warm generally. I can't remember what's the temperature, but it does not allow the silver ions to remain in the blood for a long time. It just targets, the bacteria or the DNA of the bacteria and ruptures it, suffocates, and then it just goes on targeting. It's like a magnet drawn to the bacteria, right? And then it just breaks down, dissipates.
Now, my question is, does it come out through the urine or come out through the feces?
As I mentioned in my earlier slides, any accumulation of those will will be washed out through the sweat, through the urine, or even through the liver, and it does not hold, the liver does not hold any of these substances other than the other types of toxins that you find, right? So it doesn't hold. It just comes out through the sweat glands or through the urine, or even sometimes through the feces. That's a long-term study we have done. Well, talking about Diamond Energy Water, I know the company. In fact, I actually even did a talk for them many years ago. There are many types of water filtration systems, manufactured by many companies. You have the triple carbon filtration, you have the 6 filtration system. And off late, just about a couple of months ago, a direct selling company by the name of Hi-O, you probably know of Hi-O, they launched a revolutionary 6-cylinder carbon system. And the minerals that comes from the tap, right? Whatever that comes from the tap, chlorine, is eliminated. And according to some of these companies who so-called claim the minerals are washed, the minerals are intact, are actually true. Because I personally have done some research in water filtration or filtered water. You still find the minerals, trace minerals and essential minerals still in the water. The easiest way is to do a water test. every single lab in the country can do a simple water analysis test. You want to determine whether these are the essential minerals that are there or whether these trace minerals are still there. So the company owes a duty of care to the customer by telling the customer or showing the customer. You can actually insist, can I look at your, your water analysis, or report, to say that, these minerals are there. They are obligated to provide you this information. Consumer rights, remember.